Hello, everyone. My name is Mitisha Gupta, and I am your host for today's podcast, Win Over Hypertension, where you can learn how to take care of your blood pressure through exclusive insights and practical advice. Today, we're talking all things about hypertension. Why is it caused, how it matters, and most importantly, how to take care of it effectively. Hello, doctor. It's my honor to have you on this podcast today.
I'm Dr. Amos Aminath. I'm basically a family physician and an oncologist. I come here to speak on hypertension. So we'll just have a general idea of hypertension.
So, doctor, by now we all know what hypertension is. But can you please elaborate on it? I mean, why is it so important for us to take care of ourselves even when we feel fine?
Hypertension often does not cause symptoms until there is significant damage in the arteries. Just because we feel fine, it doesn't mean that blood vessels, the heart, the kidneys, or the brain are unaffected. Having consistent high blood pressure, it strains your arteries, making them less elastic, more rigid. This can lead to serious heart attack, kidney failures, or stroke. Even if you're not feeling any symptoms, high BP, it's like having a fire in the wall. Just because you don't smoke or just because you're living a healthy life, it doesn't mean that nothing is burning. If untreated, it significantly increases the risk of heart attacks, strokes, and kidney failure, and even causes dementia. According to WHO, nearly 4 to 5 people with hypertension are not adequately treated.
Okay, but why is it so often called the silent killer? What makes it so dangerous over time?
Hypertension, it is called silent killer because people can live with hypertension, with a very high, dangerously high hypertension, without knowing about it. They won't know whether they have it. Look at it this way. It's like having rust inside your pipes, water pipes. It may not be visible outside, but still it weakens the whole system. And if untreated, this hypertension can significantly increase the risk of heart attacks, the strokes, kidney failure, and even cause dementia. According to WHO, hypertension is responsible for approximately 10.8 million deaths globally every year, many of which are actually preventable. In India, it is responsible for about 57% of the stroke deaths and 24% of deaths due to heart attacks.
So, doctor, I would like to know what are the most common reasons people develop high blood pressure? Is it genetics, lifestyle, or something else?
Basically, it is a combination of both genetics and lifestyle. About 90 to 95% of hypertension causes are because of primary reasons, that is primary hypertension, which means they arise due to lifestyle factors like poor diet, unbalanced food, lack of exercise, stress, and even aging. Genetics also plays a strong role. If you have a patient with hypertension, your own risk nearly doubles. Secondary hypertension, which accounts for about 5 to 10% of the cases, it is due to other diseases like kidney diseases, hormonal disorders. There are studies which show that incidents that over 70% of hypertension cases in adults are related to modified life changes.
How is blood pressure exactly diagnosed? When looking at the blood pressure readings, can you elaborate on the exact numbers people should be looking at?
When you look at the BP readings, there are always two numbers, one on the top and one on the down, below your line. So this represents actually the top number represents systolic BP, blood pressure. The lower number represents diastolic blood pressure. What it means is, systolic is the pressure of the heart when the heart contracts. The diastolic is the pressure of the heart when the heart relaxes. A normal reading is around 120 to 80 mm of mercury. Hypertension typically is diagnosed when readings are consistently above 130 by 80 millimeters mercury. Based on the latest American Heart Association guidelines, regular readings, ideally taken at home and in clinic, give the best picture.
So I would also like to know, if someone has just been diagnosed with high blood pressure, what are the changes you would want them to make in their daily routine?
The simple things first. Start with basic lifestyle changes. Reduce your salt, that is less than 2.3 grams per day. Ideally, it has to be 1.5 grams per day, but start with around 2.3 grams per day. Exercise at least for 30 minutes for at least 5 days in a week. Lose weight if you are overweight. Even a 5 to 10% weight loss can cause significant lower in your BP. Quit smoking and limit your alcohol intake. Focus on DASH diet. I'll explain what is DASH diet later. Focus on DASH diet, that is rich in fruits, vegetables, and low-fatty dietary products. These can lower your systolic pressure by about 5 to 15 millimeters of mercury, even before medications are started.
Can we say that hypertension can be treated without medication?
Maybe yes, in the early stages and very mild cases. Lifestyle changes alone can be enough in such cases. But if blood pressure is very high, or if there is existing organ damage or other risk factors like diabetes or already kidney disease, then medications is usually needed. About 60% of patients eventually require medicines, especially with the age. So the good news is when combined with lifestyle and medications, the effectiveness of treatment is better.
Okay, doctor, you just talked about medication right now. So I would like to know, what are the most common side effects that people should look out for while taking medications for hypertension?
It actually depends on what type of your medicines are. Medicines are different, placed under different categories based on how they function, how they reduce your BP. For example, the few drugs which are called diuretics, they cause increased urination and low potassium levels in your body. Beta blockers, that's another group of drugs which may cause fatigue or even cold extremities. There's a group called ACE inhibitors. These can cause persistent cough, dry cough. Whatever it is, whatever drugs you're taking, always report any side effects to your doctor. Sometimes it's just a matter of finding the right medications or dose. Side effects vary. Most can be managed by adjusting the dose or just switching medications. The key is not to stop taking medicines, or you have to consult your doctor.
Okay, I have a question related to that only. Let's assume that somebody's blood pressure is coming under control. Can they come off medication, or is it a lifetime commitment?
Sometimes, yes, especially if weight loss or lifestyle changes are maintained. But for many hypertension, it's a lifelong condition. The goal is always use the lowest effective dose and reassess regularly.
Okay, when you say reassess regularly, how often people should check their blood pressure, and what's the best way to do it right?
For newly diagnosed or uncontrolled BP, daily checks are required, both morning and evening. Once they become stable after a few days, maybe 2 to 3 times a week. Use a validated upper arm curve. Sit calmly for 5 minutes before recording BP, and always take 2 readings with 1 minute apart. And it's better to avoid caffeine or smoking before doing your recordings.
I would also like to know, what would happen if high blood pressure gets untreated for years, especially the body parts which gets affected the most?
Untreated hypertension can cause damage virtually to all your organs in the body. It increases the risk of heart attack and heart failure. It causes stroke due to damage to the brain, chronic kidney disease, vision problems, aneurysms, that is ballooning of certain parts of your arteries. It's a progressive threat. The longer it goes unmanaged, the more harm it does.
So this marks the end of our podcast, Win Over Hypertension. I would like to say a huge thank you to the doctor for for sharing such valuable insights to us. Remember, hypertension isn't just a number, it's a signal. And with right knowledge and action, it's absolutely preventable. If you found this episode helpful, do not forget to like, share, and subscribe, and share your valuable insights with us. Always remember, stay informed, stay proactive, and most importantly, stay healthy. This is Mitisha Gupta signing off from this podcast, Win Over Hypertension.